Phonological processes, speech sound development, evaluation, and intervention. Presented by Rachel Tanis, SLP graduate student. Revised by Dr. J.G. Padin CCC, SLP MPH. Definition of phonological processes. Predictable sound error patterns used by children to simplify speech. Considered a normal part of speech and language development. Processes gradually disappear as children mature. Persistent processes may reduce intelligibility and require intervention. Phonological disorders involve patterns of sound errors rather than isolated sounds. Phonological processes are predictable speech patterns that children use to simplify words as they learn to speak. These patterns are considered a normal part of speech and language development during early childhood. As children grow and their speech skills mature, these processes gradually disappear. However, when these patterns continue beyond the expected developmental age, speech may become difficult to understand and intervention may be needed. A phonological disorder occurs when a child demonstrates consistent patterns of sound errors rather than difficulty producing only one specific sound. Barbara Hodson, SLP, developed the cycles approach for children with highly unintelligible speech. Focused on phonological patterns instead of isolated sounds. Emphasized auditory stimulation, repetition, and gradual improvement. Widely used in schools, clinics, and pediatric speech therapy. Barbara Williams Hodson was a well-known speech-language pathologist and researcher recognized for her major contributions to the assessment and treatment of phonological disorders in children. She is best known for developing the cycles approach to phonological remediation, a therapy method designed to improve speech intelligibility in children with highly unintelligible speech and multiple phonological error patterns. Her work focused on helping children gradually develop accurate speech sound patterns through targeted practice and auditory stimulation rather than expecting immediate mastery of sounds. The cycles approach remains widely used by speech-language pathologists in schools, clinics, and pediatric therapy settings. Barbara Hodson also contributed to research, teaching, and publications related to phonological development and speech sound disorders, helping shape modern approaches to pediatric speech therapy. The cycles approach includes auditory bombardment, targeted phonological patterns, repetitive practice, home practice activities, cycles repeated until patterns emerge. Syllable structure processes, final consonant deletion, ka for cat, by 3 years. Weak syllable deletion. Nana, for banana, by 4 years. Reduplication. Wawa, for water, by 3 years. Cluster reduction. Pain, for plain, by 4 to 5 years. Epenthesis. Police, for please, by 8 years. Syllable structure processes are phonological processes in which children simplify words by changing the syllable structure, making words easier to pronounce. These changes are a normal part of early speech development because young children may not yet have the motor or language skills needed to produce complex words correctly. Substitution processes. Fronting. Tat, for cat, by 3.5 to 4 years. Backing. GOG, for dog, not typical. Stopping. Tun, for son, by 3 to 5 years. Gliding. Wabbit, for rabbit, by 6 years. Vocalization. Apo, for apple, by 6 years. Deaffrication. Ship, for chip, by 4 years. Substitution processes are phonological processes in which a child replaces one sound with another sound that is easier to produce. These sound changes are common during early speech and language development and are considered a normal part of learning to speak. Assimilation processes. Velar assimilation. GOG, for dog, by 3 years. Nasal assimilation. Money, for bunny, by 3 years. Labial assimilation. BEB, for bed, by 3 years. Assimilation processes are phonological processes in which a child changes one sound in a word so it becomes more similar to another sound in the same word. This usually happens because the child is trying to make the word easier to pronounce. Assimilation is a normal part of early speech and language development. Atypical processes. Initial consonant deletion. Og, for dog. Backing. GOG, for dog. Glottal replacement. Extensive vowel errors. These patterns are not developmentally appropriate. Evaluation process. Case history and developmental milestones. Hearing screening. Oral mechanism examination. Speech sound assessment. Phonological pattern analysis. Intelligibility analysis. The evaluation of phonological processing includes several important components that help identify the nature and severity of a child's speech difficulties. A case history and review of developmental milestones provide background information regarding the child's speech, language, medical, and developmental history. A hearing screening is necessary to rule out hearing loss as a factor affecting speech sound development. An oral mechanism examination assesses the structure and function of the oral muscles and speech structures to determine whether physical or motor difficulties are present. A speech sound assessment identifies which sounds are produced correctly or incorrectly, while a phonological pattern analysis determines whether predictable sound error patterns are being used. Finally, an intelligibility analysis evaluates how understandable the child's speech is during communication and the overall impact on functional communication skills. Candidates for therapy: persistent phonological processes beyond expected age, multiple phonological errors, reduced speech intelligibility, academic or social difficulties, communication frustration, atypical phonological processes, moderate to severe phonological disorders. These patients are considered candidates for phonological intervention due to the presence of speech characteristics that significantly affect an overall functioning. Persistent phonological processes beyond the expected developmental age indicate delays or disorders in speech sound development. Multiple phonological errors and reduced speech intelligibility make it difficult for listeners to understand the child, impacting effective communication in everyday situations. Academic and social difficulties may arise as speech challenges interfere with classroom participation, literacy development, and peer interactions. Communication frustration is often observed when the child struggles to express thoughts clearly or is frequently misunderstood. The presence of atypical phonological processes suggests disordered speech patterns that are not typically seen in normal development. Additionally, moderate to severe phonological disorders indicate a greater level of impairment that requires skilled intervention to improve speech clarity, communication abilities, and overall participation in educational and social environments. Steps in phonological process therapy: assessment and goal selection, choose target processes, auditory awareness and discrimination, production practice, generalization activities, parent and teacher collaboration, progress monitoring. Phonological processing therapy should begin when phonological processes persist beyond the age at which they are considered developmentally appropriate and when speech errors negatively affect intelligibility, communication, academic performance, or social interaction. Many children begin therapy between the ages of 3 and 6 years, depending on the severity of the disorder and the specific error patterns present. Early intervention is important because it can improve speech intelligibility, support language and literacy development, and reduce the risk of long-term academic and social difficulties. Examples of phonological processes: final consonant deletion, ca for cat, fronting, tat for cat, cluster reduction, pane for plane, gliding, wabbit for rabbit, stopping, tun for sun. Therapy techniques: minimal pairs, multiple oppositions, cycles approach, auditory bombardment, tactile cueing, visual cueing, play-based speech therapy, drill-based articulation practice. Combination of minimal pairs and cycles. Target words. Examples: boat, train, snail, house, moon, cat, umbrella, pumpkin. Step 1. Ensure vocabulary understanding. Step 2. Auditory discrimination with picture pairs. Step 3. Child practices requesting pictures. Step 4. Modeling and reinforcement for correct responses. Example number 1. The child says wabbit for rabbit. This is phonological process of gliding. The child says wabbit instead of rabbit. Both pictures are presented, and it is determined that the child can visually and auditorily discriminate between the two words. That is, the child correctly identifies the difference but produces the word inaccurately. Since there is no real image representing wabbit, a pretend or invented picture is created. The therapist tells the child, "Give me the picture of the rabbit," and then, "Give me the picture of the wabbit." The child correctly identifies each picture and is praised for accurate discrimination. Next, the child is asked to take the role of the therapist and tell the clinician which picture to choose. The child says, "Give me the wabbit," although the intended target word is rabbit. The therapist then intentionally selects the wabbit picture because it matches the child's speech production. When the child repeats wabbit, the therapist introduces corrective feedback by saying, "But I already gave you the wabbit," while pointing to the wabbit picture. The therapist then models the correct production of the word rabbit and encourages the child to imitate it. Initially, the child may be allowed to produce a phonological approximation of the target word until the correct production is achieved. Example number 2. The child says bat for cat. This is phonological process called fronting. On this occasion, the same methodology described in the previous slide is used, with the exception that there is a representative picture corresponding to each speech production for both cat and bat. The child is presented with the two pictures and is asked to identify them receptively and expressively. Since both words correspond to real images, the therapist can directly contrast the target word, cat, with the child's error production, bat. The child is reinforced for correctly discriminating between the two words and is guided through modeling and corrective feedback until an accurate or approximate production of the target word is achieved. Video resource: Minimal Pairs and Cycles Therapy Demonstration. Importance of early intervention: improves intelligibility, supports literacy development, improves classroom participation, increases confidence and social communication, reduces long-term academic impact. Summary: phonological processes are normal developmental speech patterns. Persistent processes may require speech therapy intervention. SLPs evaluate phonological patterns and speech intelligibility. Evidence-based interventions include the cycles approach. Effective therapy includes assessment, intervention, collaboration, and practice. Phonological processes are normal speech patterns seen during early language development. However, persistent processes may reduce speech intelligibility and require intervention. Speech-language pathologists evaluate phonological patterns and intelligibility to determine treatment needs. Evidence-based approaches, such as the Barbara Hodson cycles approach, support the development of accurate speech production through assessment, intervention, collaboration, and consistent practice. For more information, please contact Dr. J.G. Padin and Padin Gabriel at gmail.com.